these chairs are not just research chairs, but they really embody Indigenous leadership and community-driven health research. Their work directly supports the IAPH mandate, which is to build Indigenous research capacity, to strengthen Indigenous health systems, and foster partnerships that advance the health and well-being of Indigenous peoples across Canada.
When we look at complaints against our practicing nurses, our First Nation nurses actually have the highest percentage of complaints in practice. So it's really interesting when we look at, it's not just getting our students through the undergraduate and the graduate curriculum, it's really how do we keep them practicing and feeling safe in the workplace. So I created and wrote this article. It's called basically CPR and Racism, a guide for individuals to help when they witness racism and how to teach an intervention to our nursing students. It's the first guide in Canada and actually worldwide that has been developed in that moment.
There are many nurses and other clinicians who want to be doing research, but just have a very distaste for research. And so created a community nurse scholar for nurses in community who have research questions and some mentorship. We have 3 Mi'kmaq nurses taking their first steps towards a PhD pathway and 81 nurses showcased on that website.
I work with the First Nations and Inuit Expert Committee of the Quebec Order of Nurses, contributed to a historic milestone. So in 2021, the Quebec Order of Nurses publicly recognized systemic racism against Indigenous peoples in the healthcare system. And this recognition, grounded in the committee's report, Improving Care for First Nations and Inuit by Addressing Systemic Racism, has led also to tangible changes in nursing education, practice, and professional policies across the province.
Central to this effort is the creation of spaces for Indigenous students to learn in ways that affirm their identity, strengthen their leadership, and deepen their commitment to improving health outcomes for their communities. So one of the key contributions has been the co-development and teaching of a course that's entitled Indigenous People, Health and Research, Doing Research in a Good Way. The first graduate level nursing course focused on Indigenous health and issues in nursing at the graduate level.
Some of our evidence was around the key piece was really enhancing these practice environments. It was really clear that students, practitioners were really looking for their own space to have these conversations on what their own Indigenous knowledge meant within their practice. So we hosted a number of webinar series through COVID. And again, we really worked with the healers and helpers because they really stepped up to the plate and provided a lot of leadership for communities and support for Indigenous nurses working in the communities.
We've started to build the partnerships already with the Canadian Association of Schools of Nursing, the Canadian Nursing Association, the Chief Nursing Officer as well, on some national initiative and policy changes. And I think that's just kind of getting started. And I really look forward to what we might be able to do together with the chairs being expanded, and particularly with 12 or 13 or 14 of us rather than 6 of us. That will, I think, really result in some really impressive and large, substantial changes.
I think our goal today is really to ensure that this program not only continues, but it grows. Every province and territory should have a nursing chair leading this work, connecting research and education and community action to improve health outcomes for Indigenous peoples.